Skin cancer is the most common form of cancer in the United States, with over 2 million people diagnosed annually. As the summer heats up and the people head outside to soak in the rays, Terrebonne General Medical Center wants to remind the community of the possible consequence of too much sun exposure. Dr. Sarah Haydel joins us now, and she's been on before. Welcome back.
Thank you for having me.
Good to have you back again. First of all, we saw the intro and everything, and skin cancer's on everybody's mind during the summer.
Sure.
And year-round for that matter, but very simply, what is skin cancer?
It's basically just the uncontrolled growth of abnormal skin cells. And so the way that that happens is actually from mutations in the skin cells. Most of the mutations come from what you would expect, sunlight exposure. So whether it's in the form of natural sunlight that you would get from playing outside or to artificial sunlight, like a tanning bed.
And so that would be the causes of skin cancer. Okay.
Yes.
Now, the different kinds of skin cancer, are there a lot?
There's basically 3 different types. Basal cell is by far the most common one. That one usually starts off as like a little flesh-colored, shiny bump that's not healing. That causes from mutations in the upper part of the epidermis, which is kind of that top layer of skin. The second most common part would be the squamous cell carcinoma. That kind of comes from mutations in the middle layer of skin. These are really common. These kind of show themselves up as red, scaly patches on sun-exposed areas, on the arms, the head and neck, the scalp, real common on the ears of men. And then the third one, which is the most deadliest form, is the melanoma. And that comes from mutations in the pigment cell layer. And that's the one that can come from sun exposure or not from sun exposure.
Okay. How do you say that second one again?
Squamous cell.
Ah, you got to go to school just to learn how to say that.
Just how to pronounce stuff. You got it.
Now, the rarer kinds of skin cancers, can we go over that?
And the good thing is we don't see these that often. Kaposi sarcoma is a skin cancer that's seen in people that have an immune system that's weakened. Whether it's weakened from having cancer of some sort or HIV, it's almost like a blood vessel tumor. So it shows up on the skin as something red or purple. Another one is called a Merkel cell carcinoma, and that's usually on the head and neck area as well of elderly men. And it also can be kind of a shiny, flesh-colored bump, but it usually bleeds really easily. That's a little sign for that one. And then the last one would be something called a sebaceous gland carcinoma. So sebaceous gland is our oil gland. So actually our oil glands can become cancerous. And the most common location for that is the eyelid. So when somebody comes in with a growth on the eyelid, we almost always biopsy it and send it to the lab to rule out something serious.
What are the symptoms? You named them all, but what are the symptoms of skin cancer?
Look for something that just appears out of nowhere. Whether it's something that's red, rough, and scaly, or something that's brown and dark. When you notice things pop up on yourself, that's a good time to get them checked out.
So know your body.
Know your body. Do skin exams just like you would, looking for other types of cancers when you get your screenings. But this is something you can do yourself at home. So just kind of put it on your calendar, look yourself over, have your spouse check your back. That's the main area I check when men come in because most people don't know what their back looks like.
Right.
So it's a good area to have your spouse help you check, and legs as well, back of legs.
Let's hold that thought. We're going to take a break. When we come back, Dr. Sarah Haydel, more on skin cancer, a very important topic, so we'll be right back after a short break.
Put together a crew of top specialists, and you can do amazing things. Cardiac care at TGMC. It all begins here.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, Dr. Sarah Alexander is back. We're talking about skin cancer and the factors, the increase, the risk of it. What would they be?
It would be somebody who has fair skin, light eyes, so a blonde or a redhead. Somebody who's had a lot of sunburns in their lifetime. Actually, only one blistering sunburn puts somebody at risk.
Really?
Family history, so we always ask if anybody in your family's had it. Growing up in a sunny climate, living in South Louisiana, or people who live closer to the equator, those are some other risk factors as well. And of course, as we get older, because that means you've had more cumulative sun exposure in your lifetime. So most skin cancers occur in people over 40. So I guess you and I are getting close to that, huh?
Oh yeah, well I'm a lot further than you are for sure. And I saw like arsenic. There's a lot of arsenic around.
That's kind of rare. So I mean, they don't really think that most of the skin cancers come from that. But I guess any type of environmental toxin or a weakened immune system, again, could be a risk factor as well.
All right, now screening. So when should I be screened for skin cancer, for example?
Yeah, most people come in when they're about 20, and I break out this little gadget right here. This is called our dermatoscope.
I was wondering when you were getting to those.
And what this is, it magnifies it and has a light, and we're actually taught what different skin cancers look like under this little pocket microscope. And this has really helped in not us having to remove so many moles, so many biopsies, because you can kind of screen people better with this. So it's a little gadget that we just keep in our pocket, and we can look you over really well. And then if we see something suspicious, we can do a biopsy of it. So, we numb it up, we can shave it off, send it to the lab, and usually within 3 to 5 days, they'll give us a result, tell us if it is a skin cancer, and if it is, which type, so we know which treatment that we need to do next.
Okay. Now, how do you test for skin cancer?
So when you actually take the piece of skin, they actually process it in the lab and look at it under the microscope, and they can do stains on it to test for the basal cell, the squamous cell, and the melanoma. And they can actually give you a depth, which is really important in skin cancer, so how deep it travels.
So it's stained. I mean, what is that?
It's just kind of like little chemicals that they throw on the tissue that lights up certain cells, so they can tell which one is which.
Okay. Now, treatments for skin cancer, what would they be?
So it's basically depends on what kind it is, how large it is, where it is on the body. So simpler ones can be treated with liquid nitrogen, which is what we use to freeze warts. And then it kind of goes up from there. You can, what we call, do a scrape and burn of it, where you kind of numb it and scrape it off. You can cut it out and put stitches. Some people are not candidates for surgery, and we actually do radiation therapy.
Okay.
And then we can, there's a special procedure called Mohs surgery, where you actually have the skin cancer cut out. They process the tissue while you're in the waiting room, and they don't put you back together until they know they've gotten it all out. So that's kind of a really cool specialized part of dermatology.
Medicine's come so far.
Yes.
Now, I'm sort of stubborn. I don't listen to my doctor like I should. So how do I reduce my risk of skin cancer? Let you fuss me. So how do you do it?
This is kind of the newest trend. These are kind of some swim shirts, and these have something called UPF, so not SPF, and this stands for ultraviolet protection factor. And these actually block 98% of the sun rays. So I love these on my children. We have them in styles for adults as well, because when they have these on, you don't need to put sunscreen on underneath. And then you can just focus on the areas that are exposed.
You got clothes that block sunlight.
98% of the rays.
Wow.
And then we even came out with sunscreens that men like that are not goopy or greasy. This is a little powder that's waterproof. You can keep it in your golf bag or in your boat. And when you put it on, and when you reapply it, it never burns because there's no chemicals in it.
Wow.
So it's kind of neat when you sweat that
cool.
you're not. So we actually can motivate you a little bit more now with just clothing, hats, and
And they have different
more
colors in the
elegant.
powder?
They do. So it comes in different shades, so you can kind of match your, olive complected people. Obviously, it's a little bit darker. So this is my new favorite sunscreen. Keep it in your purse at the ballpark, and then this is another one that we like too. Has a nice little tint to it, Mela Shade. This is just one of my favorite ones. So these are my top 2 sunscreens that we sell in the office. But anything that's SPF 30, I'm happy with.
Yeah, so you got the name on there. You got your own
Yeah,
brand,
a little
huh?
logo.
There you go, your own brand. So somebody watching tonight and more information, they want to get more information, what should they do?
I love the Skin Cancer Foundation's website. I think it's skincancerfoundation.org. They have awesome statistics on there. They have webinars on there. If you're ever diagnosed with a melanoma, they give you the up-to-date latest treatments of where you should go to have those treatments if it's necessary. So that's one of my favorite websites.
All right, in closing, just one question. They have a man shirt and a double X
They
that I can
do.
wear around the pool?
Would you like it in black or blue?
Black, of course, all right?
Yes, of course.
Thank you, Doc. Appreciate you being on.
Sure, no
Great,
problem.
great information.
Thank you.
All right, we're going to take a break. When we come back, in the Canada's kitchen, what are they cooking tonight? Stick around and find out. We'll be right back.